Hi, I'm Dr. Mark Lewinter, licensed acupuncturist at Metro Acupuncture in Atlanta, Georgia, and I'm here with my two lovely co-hosts, Dr. Andrea Lewinter and Dr. Fang Wan. How's everyone doing today?
We're doing great.
Great.
Excellent. So, as I've mentioned in previous episodes, Dr. Andrea Lewinter is my mom, so I'm glad to have my mom here with me, and we have our newest member of the channel, Dr. Fang Wan, and I'd like to introduce you, Dr. Wan, to the channel.
Thank you.
So, Metro Acupuncture has some very exciting news. And if you've watched some of the previous uh, shows or videos that we've put up, you notice that my background today has changed. And this is a picture that I took when I was traveling to Santorini, Greece. And the reason I changed my background picture today is part of the exciting news is that I have sold the practice to Dr. Wan, and I am going to be traveling full time and hope I will be seeing wonderful sunsets and sunrises, such as the one that I saw in person a few years ago in Santorini. So, uh, I wanted to get into this exciting news. Um, it was a few months ago that Dr. Wan reached out to me, and we talked a little bit about Metro Acupuncture and the practice. And she shared with me what her professional experience has been, and it seemed like a perfect match to continue the legacy of Metro Acupuncture. So I'm going to be stepping away from Metro Acupuncture, but Andrea Lewinter and Laura Bowman and now Fang Wan will be taking the helm, and I know that we have a great team to be able to move forward and continue to care for patients in the Atlanta, Georgia area. I, as I've gotten to know Dr. Wan, she has shared with me some very uh, impressive information about her professional background and her training. And she's very humble. And when she has shared with me the her part of her training, it included working at one of the most prestigious traditional Chinese medical hospitals in Beijing and maybe even in China. So I'd like to hear a little bit more about that. Dr. Wan is not only an acupuncturist, but an herbalist. So we can talk about that. And I think that we now have a team that is going to be able to not only offer acupuncture and herbal medicine, but also acupuncture from the one of the countries where acupuncture was created. And I would like to hear a little bit more from you, Dr. Wan, just about your professional experience.
Okay, thank you. Yeah, so thank you, Dr. Mark. I actually grew up in China and graduated from Beijing University of Chinese Medicine. Um, and then I work at Guamen Hospital from 2004 to 2011. Uh, actually 2015 for 11 years. Sorry. So that is a top hospital in China for many years for Chinese medicine. And I work as an internal medicine physician, uh, combine the Chinese medicine and the Western medicine for most of the time. And that is a very busy place. So we have to treat about hundreds people a day. So it's fast to accumulate experience for like just graduate that time. Yeah, and I got my master degree for endocrinology, focus on the hormone imbalance, type 2 diabetes, thyroid issue, overweight. That is I focused. But I did work at emergency for many years. So we treat infectious disease, or anything urgent, um, combine the Chinese medicine and the Western medicine. So I think I get a lot of benefit from China, the experience, and I got followed a lot of famous doctor there. So they 90 years old, very a lot of experience. So it's a great experience for me to catch up as a yeah Chinese medicine doctor. And for myself, I enjoyed the time we help people for their pain or the hormone or anything medical condition. If we can make them better, for me is the best.
Yeah, that's wonderful. I wanted to kind of touch on two things. One, I remember you shared with me that you mentioned that you would treat sometimes 100 patients a day, and also that because this hospital was so well respected, patients would line up to get into the hospital. And I remember I shared with you, like, oh, so they would get there early in the morning to line up, and you said sometimes they would get there the day before to be able to get in. Like that's how much people valued the services that the hospital offered, the acupuncture and herbal medicine, and how different that is. And it's not better or worse, but it's just a different perspective where many of the patients we see at Metro Acupuncture at our Atlanta acupuncture practice maybe haven't had acupuncture before. So they may need to have a little bit more of an understanding where you shared with me that some of your patients are saying, no, you need to put the needles here, 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 and here, or I'm taking this herb and this herb and this herb. So it's,
Yeah.
tell, what's it been like for you to kind of be move from a place where the culture was so aware of acupuncture, the value of acupuncture and herbal medicine. It may be something that they pursue as the first line of approach to address their medical concern, versus here in the United States, it might be kind of like a secondary, third, maybe even fourth thing that they think about. So many times we'll have patients at the practice and they'll say, this is this is my last hope. And I'm like, oh my God, no, so
Yeah.
what's it been like for you to kind of be in those two cultures?
Yeah, in China, because that's our medicine, Chinese medicine. So a lot of people they will do Chinese medicine first. Take example like infertility. Before they try to be pregnant, they will do 6 months or 3 months acupuncture to just make the health better,
That's
and
right.
that will make everything easier. The pregnancy, the energy, emotion, hormone. So they will do that. And culturally, their parents will recommend. The
Yeah,
mom will
right,
say, I will
right,
pay for you.
right. Yeah,
Mother-in-law will say, I will pay for you. You just
yeah,
go.
yeah,
They,
yeah.
so they recommend, they encourage them to do that naturally in the first stage, even before they are ready for having a baby.
Yes,
So
yes.
and
And what's it been like kind of with seeing so many patients who haven't had acupuncture before? I know that you love this medicine and I'll hear you in the treatment rooms and you'll be laughing with the patients. They must be having a good time. And I know that you love to share this information. You've shared so much valuable information with me about herbal medicine and the
Mm,
names of the acupuncture points and the
mm,
strategies. And like you said, you've worked with these legendary herbalists and acupuncturists who were in their 80s or 90s and still treating. What's it like for you to be able to introduce people to acupuncture who've never experienced it before?
okay. So I worked in China 11 years and here 11 years, like half half. Now I even feel acupuncture is more effective for American people. And like we need maybe 40 points, but we only need 10 points for American people because we probably for 5 or 10,000 years, Chinese people get used to the acupuncture. So not as effective as here. So we need to do sometimes every day, 2 times a day treatment to make them feel the best. But here we actually even more effective. We can just do once a week or a few times a week, depends on their condition. So if I love to introducing acupuncture to American people, with my background or knowledge in China, I think acupuncture is a natural, holistic healing for everyone, uh, no matter physical or emotional stress or pain or anything. No one is perfect. After years work, stress, take care of the family, the parents, the children. If you want better health, acupuncture is your choice.
Yes,
Uh,
absolutely. Yeah.
yeah.
I
So
And
want to interject something here,
yeah,
Mark.
please.
Is that Fong is not only bringing this wonderful medicine to us, but she also does facial acupuncture. So this is going to be a new venture for Metro Acupuncture too, to offer rejuvenation of the face, of the complexion, and so she
Yeah,
comes with that knowledge as well.
yeah. I feel a lot of a place like New York, the famous star, they do acupuncture every week for whole life, and they looks like 40 years younger than their age. And acupuncture is a part of their life. I think when we do for the beauty, for the face, facial, or manage the weight, in China, the first lady. That's people say that's our face. Like the first lady is our face. So she is doing acupuncture actually for weight management and for the glowing. She is beautiful, but she want to be more beautiful, like want to be better. And I think everything from inside is real beauty.
Yeah.
We don't only focus on the skin. Actually, we focus on the hormone, energy, and balance. When you if the beauty is comes from inside, confident and no pain, and
And I
better
think
energy, better sleep. But meantime, if they have tiny lines, or like puffy, sometimes the lymph nodes get slowed down
mhm.
to detoxify, and or the eye get little lines or wrinkles, or from not good sleep, get more um, darker color, like we say sallow or
Mhm.
darker, or from the sun, like the strong radiation. Acupuncture would be able to improve the circulation. And skin is a final organ, bigger bigger organ.
Biggest organ
So
in the body. Yeah. Yeah.
yes, so sometimes we don't focus on that. But everyone, no matter woman or man, they could get a much better looking with acupuncture from interior and exterior.
It's so true. And you can even see, I've seen pictures of people maybe before an injury and then people after an injury, and you can see, oh my gosh, their hair got gray, or you begin to see those lines on their face even more. So there's that yin yang approach. It's like if you're feeling better on the inside, you're going to
Mhm.
look better on the outside. Maybe if you begin to help improve the largest organ in the body, the skin, then it can
Correct.
help other organs. So
Yeah.
since East Asian medicine is all about connections and one thing leading to another, it makes sense that yeah, if your face looks good, you're gonna you
Yeah.
also maybe feel better.
Yeah.
And I think
Especially
this is
if your face looks good, because naturally you're doing
Mhm.
you're doing things like getting enough sleep, maybe doing acupuncture,
Yeah.
eating the right foods.
Mhm.
and I think this is a concept that's well worth, pursuing for Americans, because Americans associate acupuncture with pain. If I don't have
Mhm.
pain, I don't need to come to, but it's this emotional piece, this
Mhm.
physical piece, the balance of our energy, and our energy is everything. It's how
Yeah.
we look, it's how we sound, it's
Yeah.
how we present ourselves. So,
Mhm.
this is really a wonderful, wonderful way of introducing people, again, in a little bit of a different way, to
Mhm.
the tremendous value of
Yes.
acupuncture.
And
Yeah.
I think as acupuncturists, or at least this acupuncturist, and then we've shared about this in previous episodes, Mom. I'll be like such a doubter of acupuncture, but like last week I was in the Czech Republic. I was in Prague, and I started having neck pain. Well, I travel with acupuncture needles, and I put a point in my hand, and I stimulated it, and the next day total elimination of neck pain. Could you imagine if I was lugging around a suitcase and a backpack and I had neck pain? It can spoil one's trip. So
Mm.
I love that we not only have this medicine that we can give to other people, we can also remember we need to remember how special it is for ourselves, and we can teach patients. Like if we know that someone's going to be taking a trip, and we say, "Oh, here, while you're away, you can press on this point." Or if you're traveling and you have stomach issues, you can press this point. This is a medicine that is actually kind of at our fingertips. And I think since we all do this, Dr. Wan, you've been doing it for a very long time. Andrew, you've been doing it for a long time. I've been doing it for a while, and we forget how precious it is. And
Mm.
I also think that in forgetting how precious it is, sometimes we can get in routines. And I love that Metro Acupuncture has a new practitioner that brings her own experience, her own excitement, and it's just been vibrant the past few weeks at the practice, because I do think that patients in the area come to the particular practitioner that will help them the most.
Yes.
And we've been seeing all sorts of patients that I think, Dr. Wan, you are particularly good at treating. Maybe like a patient with Parkinson's, or a patient with a chronic viral issue. You already mentioned a little bit about some of the things that you like treating. What's your experience been like the past few weeks being here at Metro Acupuncture?
I have a great time here. I love Atlanta people. People are so nice, knowledgeable, and they know Chinese medicine, they know acupuncture, and I feel so many people they have the experience or background as a medical, like public health, or nurse practitioner, or doctor.
We've got some
I,
great hospitals. We've got the
yes,
CDC, and a lot of patients come to our practice because of the area that we're in, that are, like you said, highly educated.
yeah,
I feel very fortunate, the patients we have.
yes. Just highly educated. You can feel they're very knowledgeable. That is very uh, I feel happy like with that. And
Yes.
I do feel there's still some people suffering the symptoms after COVID, like
Yes.
they lose the taste, the smell, or people get tinnitus, the ringing in the ears, even 5 years, they still suffer from that. And I have some cases they actually struggle with the years, the symptoms like fatigue, depression,
Mhm.
not good sleep, or some weird symptoms. I don't want to say here. So that means even after long time, our qi, the vital qi, is still not be able to recover or fully recover from a very strong infection, like
Mhm.
a COVID or severe flu. That happened even before COVID. We saw people in China, they lost the taste after a severe flu, they never come back. That's the most fun of the life is the
Is the
when you
taste.
eat.
Yeah, right,
If
right.
there is no taste, you cannot enjoy.
What's it about? Yeah.
What's that about? And and that's a lot of time we just can help them with acupuncture and herbal medicine. We bring the sensor back by unblock the channel.
Yes.
uh, like if they have tinnitus, we just do the channel around the ear. That's actually is gallbladder channel here
That's
for
right.
no matter hearing loss or tinnitus, or if it's the smell or taste, there's something the virus just broke the pathway of
Mhm, mhm,
the
mhm.
neurology. So then we acupuncture just can create or regenerate the pathway back.
That's right. Yes.
Yeah.
And I love that. Like I remember in 1998 when I went to China for the first time, I realized that this wasn't just something that I was studying. I was around people who absolutely, without a doubt, believed the philosophy of yin and yang,
Yeah.
the value of meditation, the value of eating well, and I am if over many years of treating patients, I may have lost some of that essence of the tradition of East Asian medicine, and you've really brought that back because you see how when you correct these imbalances, people can get better.
Yeah. Uh, I I think Dr. Andrew, she does five elements
Yeah,
acupuncture.
yeah,
So no matter yin, yang, or five elements is deeply in our blood.
that's right.
Yeah, for
That's right.
Yeah.
for Chinese medicine practitioners. Yeah,
Yes.
even we say yin yang, most of the time we'll base on the five elements. So we sometimes we say we need a better yang or need a less yin, but we want to address which organ, which element is the liver yang too much, or the or
Mhm.
the lung yang or the heart yang. If we combine everything like acupuncture points. So there's some point that is the five element. It's a wood point, fire point, water point, and the herb. The herb actually from the color, the taste, what season we get pick up them, or the shape, we can give them five elements and the yin yang. And when we diagnose people, we give yin yang diagnose, we give five elements diagnose. So that give us a possibility to balance everything. So if they have less yin, then we can use the herb. They can help the yin
Mhm.
to balance. That is how we treat post-menopause or perimenopause. Um, I, I think the five elements and the yin yang is just the basic uh, for Chinese medicine or acupuncture. If we do everything the same logic, it will be perfectly fixed issue. We will think traditionally Chinese medicine has been many, many years, right? But recently, because the West medicine came to our country, so
Mhm.
people often say West medicine is faster and Chinese medicine is slower. Uh, that's not the case. That's just people think about, oh, antibiotics, 3 days can fix everything.
Yeah.
But they sometimes it's good. Sometimes if it's not necessary, it destroy the gut, the bacteria, and it make a lot of people feel sick, like uh, uh, nausea, vomiting. I think if we do good job, uh, like sometimes our patient comes for, I will just try. This is, I will just try. I don't have any experience. I will try field visit to see it will help. The thing is, for in China, for my experience and my experience in Minnesota, Colorado, and here, we've never seen acupuncture doesn't work. We always, if it doesn't work, it probably need a more treatment, or probably need a different points, or need or need a combine the electronic stimulation or cupping or herbs. Um, it's medicine. If we do good job, I think people just be more patient. We should be more patient. Patient will be more patient. Uh, it will work. It's just how many treatment we need to make you feel a huge improvement, and then how many appointment we need to maintain the best results. Uh, Now this week I actually had a patient. She has been struggling with the hives for 6 months.
So like hives on the skin and such. Yeah.
Um,
Yep.
Everywhere.
Hives all over the body. Yep.
Yes, it
Yep.
will comes in the morning when she wakes up, and after she used the steroid, antihistamine, the cream, it will be gone after, a few hours, but it will come back in the afternoon again. So 2 times a day all over, even the eye, front and back. So she already, I think, very disappointed, and that impacted her everything. Like she has no energy to do exercise, so
Mhm.
her joints hurt, hip
Mhm.
back, and I think for skin issues, the big issue is anxiety. You never know what time it will come, will show. Even she's in the probably in the church or in the shopping center. It just very annoying, itchy, burning, and just all over. People can see that. Um, and I'm not a dermatologist, not in China or here, but I just we discuss, uh, analyze with the Chinese diagnose with the Chinese herb, Chinese traditional Chinese medicine, the herb, the acupuncture. We do a few times a week, and yesterday she told me it's just completely gone. I was
Wow.
so
Wow.
uh yesterday whole day I was happy.
Yeah,
Like
yeah, it's
and
so awesome when we can help people. And sometimes it's adding something in, sometimes it's taking something away. And I love that our practice, we talk about not only acupuncture and herbs, but lifestyle. What are you eating? Are you able to get exercise? Are you sleeping good? I know
yeah.
we've been talking for a little bit, and I'm so sad to be leaving because I've really enjoyed this conversation. Um, and the purpose of this call was to be able to introduce you, Dr. Wan, to the practice. Andrea, you're losing a son, but you're gaining Dr.
Daughter.
Wan. What's this like for you? How are you experiencing this transition?
Well, some people have asked me, like, oh, Mark is going away and aren't you going to miss him and so on. And my feeling is not of sadness or grief, but of great joy is that my son is following his heart, is following his spirit. And this is, as far as we know, this is the only life experience that we have in this time. Okay, and that he should do that, and I'm very, very happy and excited, and like you said, it's like Mark is going away, but I have a new daughter.
Oh, yeah, yeah.
Yeah.
Well, it's going to be great. It's my hope that you all continue to do videos, because I really think that
Yeah.
we have a lot of wisdom to share, and whether that be someone who's in the Atlanta area and wants to come and see us at Metro Acupuncture, or maybe there's someone who doesn't have an acupuncturist near them, and they could do some acupressure, or they could do something simple with spices, which are like, or Chinese herbs to help their condition. So we have so much to give. As you were saying, Dr. Wan, it makes us really happy when we're able to help people. So I hope that you will continue. Know that all patients can schedule online at metroacupuncture.com. We see patients 6 days a week, and everything's going to stay the same. Andrea is going to be seeing patients. Dr. Laura Bowman, who's an acupuncturist and a physician, is still going to be with the practice. All of our admin is the same. So the only thing is I'm gonna be leaving, but I know that the practice will be in great hands, and I feel honored to be able to have the legacy continue with a great team. I want to thank you both for being here today and allowing me to introduce this next stage, a very important and exciting next stage for Metro Acupuncture.
And thank you, Mark, for building this.
My
Yeah.
pleasure. It's been a labor
And
of love.
welcome, Dr.
So, the
Fang.
labor of love, I can just now I can just let loose and I'm to travel. So, thank you both,
Thank
and
you.
yeah,
Yeah. Thank you.
bye bye.
Bye bye.
Bye-bye.